Counseling is a professional help to any human being, individual, couple or family or a group, because people get problems, they get stuck with some feeling, maybe some negative feeling, they are not able to decide, they are not able to cope with life's demands, they want to go forward but they are not able to. They may not even know where the problem lies and how to solve those problems. A professionally trained, educated person using psychology and psychological methods can help someone to understand the origin of the problem, the maintenance of the problem, and how to solve the problem. Okay. Generally, counseling helps the client or the counselee to make use of one's own resources so that they can help. And if they realize that they are helped in one way, for one problem, they can also make use of the same strategies, techniques and understanding for another problem they may come up with in future. So this is a professional help, not a casual conversation. Usually the counselors meet people in a professional setup. The problem can be physiological, starting point could be physiological, it could be psychological, it could be relational, they are not able to relate well with people or problems in relationship, or it could be even lack of meaning and purpose in life. So it could be any problem, the range is very vast. Anywhere, if they realize that they are stuck, they are not able to help themselves, they can go for counseling and the counselors will help with the use of psychological methods, using all kinds of techniques, they will help them. Anybody has problems, anybody may develop problems because of the developmental stage they are in, they are not able to understand the stage, they are not able to cope with the demands of the age or the stage they are in, and there are lots of demands, also reasons for stress like academic stress. Students are in a particular stage, maybe adolescence or even beyond, and they have physiological needs, hormones, relationship problems, and they are not able to reach up to their own goals or the goals fixed by the parents, and assignments, exams, other social responsibilities, they are not able to meet. So they have lots of problems, stress. Some they can manage on their own, some they cannot. So they may also require some help. Not all will require the same kind of help. For some people, some information, some advice, some guidance will be enough. For some people, they will require deeper understanding of their problems, their own inner resources, and they can do better with the counseling. The basic reason is that people are not able to help themselves. If a problem is outside, like for example, you give me an arithmetic sum, it is a problem, I can find a solution. But if I have a problem personally, I may not be able to see all the nuances of the problem. So someone else objectively can see the problem better and help that person. This is where your problem is, and these could be your solutions. This is how we will, that is why we will say counseling is important. In our country, counseling has a stigma attached to it. When people are able to accept their physical illness, like somebody will say, I have stomachache, very boldly. They are not afraid or ashamed of saying that they have stomachache or leg pain or headache. But if it is connected with psychology, if they have some psychological issue or psychiatric problem, the culture doesn't encourage them to acknowledge that they have a problem. Even parents will hide it as long as possible. So people develop various problems. Okay. But if they can accept that they have a problem, then they can help themselves very quickly and move on. Is it only for the seriously sick people or for ordinary people? Originally, counseling was started for ordinary people, for their ordinary problems. They are not psychiatric problems. Okay. So, counseling is meant for anyone, because we never reach our goals as human beings. For example, I may have a lot of potential in my mind. I may not use all of them. If we use all our human potential, the potential of the mind, we all can work miracles. But we don't. We use minimum. So we get stuck on the way. We have the potential, but we never realize that potential. So counseling can point out to them, you can go a little further, you can achieve, you can move and be an achiever. So there is a particular phrase called self-actualization. Self-actualization is making the best use of all the potential I have. There is a need, but we generally get stuck with very basic needs of physiological needs: food, water, air, sex. Then we are concerned about safety and security needs. If I am not secure, I will look for security. If I am not safe, I will do something so that I am safe. Then I also require social needs, love needs. I want people to love me, or I want to love people. I want to belong to somebody as this is my own. And also we want respect from other people. These are the only 4 people will give importance to. There are greater needs or higher needs. Like self-actualization, people are busy with in their whole life only these 4. But we have a need to go beyond. But do we go? That is the question. Some people will realize, I have a desire, I wanted to be an artist, but I never got an opportunity. I wanted to be a medical doctor, but I never got this chance. So what can they do? Can they move on, or only get stuck with the 4 basic needs? They can go, they will achieve, they will be great people. So for that also, they can go to any counseling to understand their potential, what they can do if they get a chance or opportunity, and move on. Sometimes we give up, no motivation, so we get stuck. So to motivate, to decide, to move on in life, counseling could be useful. People believe that the counselors will keep all that they hear from the counselee to themselves. They will not discuss or share with anybody. It is true to some extent. Why I am saying to some extent? Suppose the client is telling me that he is planning or having an idea of killing himself or herself or killing someone else. I should not keep quiet. As I am responsible to keep his ideas and thoughts or sharing secret or confidential, I also have a duty to protect another person whom he may kill. So, if there is suicidal ideation or plan, or homicidal idea or plan, ideation or plan, then I will break the law of confidentiality and share with someone so that others are not harmed. Okay. If someone is abusing a child or a very elderly person, very vulnerable people, even there I should not keep quiet, because if I keep quiet, the abuse may continue. I cannot allow a young person or a very old person, a vulnerable person, to be harmed again and again, even though the abuser is coming for counseling. But for all the other things, we normally keep it to ourselves. If a counselor has a doubt in the diagnosis of the problem or how to help this person effectively, he or she can consult another expert, provided that person also keeps it to himself or herself. So, confidentiality is maintained. Even if I share someone's problem to another person for discussion, I will not share the identity of the person. I will only share the problem so that I get some enlightenment about the problem, so that I can help the client more effectively. Like for example, student counselors or people who have completed their master's level or even PhD, they require supervision from an expert when they are doing counseling for somebody. Even our old students contact me for supervision. They have some difficult case, they will discuss with me. I may not be able to identify, even if I am able to identify the client, I will not reveal it to anyone. Okay. So, that is how we maintain confidentiality. If I remain confidential, then the client will have more courage to share even very serious problems. Only these two, abuse and now suicide or murder, we are careful because other people should not be harmed. Then we break the law of confidentiality.
Thank you.
Anybody may go through depressive feelings for a little while. I expect something, I don't get it. I have a need, that need is not fulfilled. Then I may have some disappointment, some irritation, and maybe some depressive feeling. That is not technically a depressive disorder. It is not a major clinical depression. The symptoms for a clinical disorder of major depressive disorder is that somebody feels sad most of the time during the day, every day for at least 2 weeks. They think about death or suicide most of the time. They give up all their pleasant activities they have been doing. Suddenly they give up and they are remaining idle, or they are ruminating over something. They may not eat well, or they may be eating too much. They may not sleep enough, or they may be sleeping too much. So, all these put together, and a few more symptoms are there. At least 5 symptoms should be there to diagnose that this person has experienced or experiencing major clinical depression. Okay. There are some people who feel depressed from childhood. If you look at them, they look always sad, they are not happy, nothing excites them, they are not interested in anything positive or joyful, their face looks dull, they have no energy. This may be affecting them from childhood, maybe it's mild. But if they are functional, if they are able to do their work well, let us say you give them some work, they are able to study in spite of their depression, then it is okay. But if they cannot manage their life, if the depression affects their feelings, emotions, their behavior, their thoughts, it affects all their functions in their life, then we will say that somebody is going through serious clinical depression. Okay. So, if they are feeling sad because, let us say, the boyfriend or girlfriend doesn't talk to him or her for some time, people go through disappointment or anger or slight depressive feeling. It is not a depression in a technical sense. Okay. But all of us feel sad sometime or other. Saturday, it's not a holiday, it's a working day. Some people may have irritation or anger or depressive feeling. That is not clinical depression. Okay. I expected 85% of marks in the exam. I got only 82. One may go through depressive feeling for a little while, temporary, for a short while. Then if he can manage, then it is not serious depression, but depressive feeling. See, for any problem, there are 2 kinds. One, you can approach the problem and solve it. Why do I feel depressed in my mind? Why do I feel sad? Or why do I feel angry about this? By the way, depression and anger are 2 sides of the same coin. Some people will have no energy, no desire to do anything. Other people may be angry. Sometimes they don't know why they are angry, but they are angry. Angry with other people, angry with the system, angry with the world, angry with God, or they may be angry with themselves. So, from ordinarily observing somebody, you may not know whether they go through mere anger or depression. But if they realize, they have depression, you can approach in two ways. You can approach and solve the problem. From when did I feel depressed? What made me feel depressed? Is there any particular cause? Suppose somebody scolded me or abused me. I felt angry, but now I feel why people always treat me like this. Then I go into depression. I negatively attribute to myself. Then I may feel sad, yeah, all my life is like this. So I can go into. So find out the origin of the problem, how I have been maintaining the depression, and what methods or what efforts have I taken to solve depression. Are they okay? If something is wrong, if something is not effective, then I should change. The technique is, if something works, I will do more. If something doesn't work, I will stop it. Suppose in depression I feel like eating. I eat a lot, let us say, in depression. But it may have other consequences. I may stop my depression, but I may put on weight, or I may develop diabetes. So we look at the consequences and then decide, is it the best method to deal with my depressive feeling? Or should I look for something better? So in this case, counseling will help. Sometimes we approach in a particular way. That approach may be I have used earlier, but may not be very effective. But someone else subjectively can give me directions to use effective techniques to deal with my depression. This is one approach. Another one, avoidance. If I do this, I become more depressed. So I will not do this. For example, addiction and so on. Let us say, I will give you an example. Addiction to even chocolates. Some people like sweets. If they are interested in eating chocolates or some other sweets, no, I will have a plan, time structure. When do I normally take sweets? Morning or evening. I will think about it. I will not go to the place where I have kept sweets or chocolates. This one, I decide, I approach the problem. Another one, avoidance. I will never go and buy chocolates at all. If anyone gives me, I will say thank you, I will not get it. So either approach or avoid. Anyway, whatever suits you, whichever technique is helpful, you can take it. It's not only about depression, about any problem. How people approach a problem, they will base their thinking or expectation or plan based on their past experiences. In the past, if they have failed in dealing with depression effectively, they will conclude, even this time I will not succeed. This is because we are always dependent on the past, we build on the past. If the past experience has been negative to me, I have never succeeded in dealing with the depression. I will start with the belief that this time also I will not succeed. Okay. So to break the cycle, you need to find some way of starting with the hope. People give up easily based on the past negative experience. Suppose I have tried a few times, let us say I have been experiencing depression in my life 10 times. All the 10 times I suffered quite a lot. I could not help myself. I don't know how I came out of them. It was always a failure. 11th time when I am about to have depression, I will start with depressive feeling about depression. I will not have any hope. So for depression, helplessness is one reason, hopelessness is another bigger reason. If I feel helpless also, I will feel depressed. I cannot manage, I cannot achieve, I cannot succeed, all that. Hopeless, no way, I cannot succeed, useless to try, so I am going to feel depressed. So, people will go into depression and then start the next time when they are going to get depression with a negative note, and they have already programmed their minds and their lives to go into depression. So, on their own they may not be able to help themselves if they have many negative experiences in the past. Someone else can make you look at something positive, may help you to develop hope. Even if you are helpless or hopeless, they can encourage you, motivate you to start with hope. That could be helpful. So, counseling is very useful. Sometimes friends can also do this. By their own modeling, if someone says, hey, whenever I feel depressed, I do this, you can try that method. If you don't succeed, maybe you better go to the counselor, he or she can help you. You must know the difference between worry and anxiety. Worry, I have a concern, I worry about it. Somebody called me, Father, do you have time? Now I don't have time. So when will I give time, because a family is coming from south to meet me this afternoon. When will I talk to this person? I am worried about this. This is temporary. Anxiety is longer term. Anxiety affects my body also. Visceral affecting will take place. I sense that my body is reacting to my mind by tremors. I shake, I sweat, I have hot flashes, I feel like vomiting. I experience many things in my body. That will be anxiety. There are different anxiety levels. One is normal anxiety. If I am worried about something seriously, then I develop anxiety. It may be normal. But if it is abnormal anxiety, I will not be able to do my work. I will not be peaceful. I cannot go to sleep peacefully. So that is problematic. So if it goes for a long time, I have always been, let us say, anxious for the past 2 weeks and more, or I develop anxiety even in the future, I am going to develop anxiety disorder, which is more serious. It's a psychiatric problem. Anxiety disorders can develop various other symptoms as well. Okay. And people can become anxious about anything. One person may be able to manage very well, another person may not be able to manage the same level of anxiety given his resources or the past. Past, let us say that he had been always anxious. Then now also he is going to suffer because of the past. If we can learn how to deal with anxiety, reduce the intensity of anxiety, reduce the duration of anxiety, and also frequency. How often do you feel anxious? I will ask. How long does your anxiety affect you? Suppose you become anxious, how long? For some people it will be over in 5 minutes. Some people the whole day they will think about what will I do, I don't know how to manage, oh, I am going to suffer. So even body reacts. So intensity of the problem, duration of the problem, and then frequency of the problem. If they have high intensity, long duration and more frequent, then they are going to suffer more than another person. Intensity is not big, not high, not many symptoms, duration also short, in 2 minutes he is okay. Yeah, I thought about it, I was worried, but now I am okay. Or it is not frequent. Those people can manage better than those people for whom the intensity is high, duration is long, and frequency is high. So any emotion, not only anxiety, we need to see whether it is positive emotion or negative emotion, and how to understand it, how to reduce the intensity, duration and frequency. Nothing is bad Introversion, extroversion has their own positives and negatives. Introverted people find answers within their mind. Extroverted people find joy, energy outside by relating, by saying hi, meeting people, having parties and so on. Introverted people can sit alone, spend time alone, reflect in their mind. They would like to solve problems in the mind. Extroverted people would like to solve problems externally. But is there anyone who is 100% introverted or 100% extroverted? No. On a continuum from 0 to 100, let us say here 100% introversion, 100% extroversion, in between we all will be there. Our education helps even the introverted people to become more extroverted, because we meet students in class, outside in games, in the bus. Especially in India, we cannot avoid people easily. Wherever we go, we have people, we interact with them. Somebody or other will say hi. Somebody will ask you, hey, when is the exam? So, even introverted people will have to relate with other people in some way or other. There are some people who are comfortable being alone. Introverted people also may have friends, but only limited friends. They are comfortable in their family circle. They can, crack jokes, they can have fun, all that. It doesn't mean they don't talk to anyone, but they used to feel comfortable with some people and they stick to those people. If they meet a new group, they may be comfortable with one or two or a few people and they are okay with it. Extroverted people are not happy with the small group. They have to go, do things, they have to learn new things, they want to experience something new, they are more adventurous. Introverted people may not be adventurous outside, but in their mind they can be adventurous. They would like to know, reflect deeply. Extroverted people may not spend time for reflection. They are more doers. Introverted people they are more thinkers, deep thinkers, want to find out what is the cause, why it is happening, all that. So there are differences. Nothing is bad. Both are needed. I need to sit back in my room and then reflect on a particular topic or a problem. I also have to go out and teach or counsel, meet new group of people for counseling or a seminar, all that. So we need to combine both extroversion and introversion. 50-50 would be wonderful, but we may not reach that level. For example, I am an introverted person. I can be comfortable with a book in my room. I can read, I can reflect, I can write. I am comfortable. I don't need to go out and meet people. But with my friends, I am quite free. Or if people interact with me, I do. So, my experience of being in school, colleges, various colleges, going abroad, meeting new kinds of people. So, all those have made me more extroverted than when I was a little boy. That's all. They can. If you feel the need to become more extroverted, or if there is a need, like for example, I know a few people who joined marketing. They thought they will sit in one room, they will come up with some designs, some advertisement. Okay, so they need not go out, they need not travel, but the company forced them to travel. Go to this place, meet so and so, do this, finish this talk. So they learned to be more extroverted, even though they would be comfortable in one particular room doing designs or coming up with new advertisement techniques. So sometimes we are forced to become extroverted. Sometimes we feel, everybody is enjoying, why am I in the room, in my own home, let me go out and enjoy. So I may try, I may succeed, I may develop more friends. That will be also possible. Whenever students go to a new place, whether it is hostel or a new job in a new place, they have to deal with three things. Place itself can be new. Where things are, where should I go and buy, where will I have my breakfast, whether it is in the hostel or any other place, I have to become familiar with the place. I have to become familiar with people around me. I may not have friends, like us in school. Okay, in the school I might have had many good friends. I was comfortable even though I was an introverted person. But in the hostel, a new place, a new college, I have to find new friends. So that may be anxiety provoking. Then the job or what I am here for, I am going to study. Is the study difficult, stressful? Do I know the basics? So I have to deal with three things: the place, people and work or whatever it is, study or anything. Am I comfortable? Or am I in a completely a new situation, missing my parents, missing the comfortable home, all that. Okay. So initially adjustment will take some time. If they can contact their parents or their friends for a little while, for a few days, until they find new friends, until they become comfortable with the place, people and work, they can manage. Sometimes people feel lonely for a long time. Loneliness may cause anxiety. Not anxiety causes loneliness. Because I am alone. See, being alone is different from being lonely. I can be alone, but I may not feel lonely at all. How? Because I feel loved, I feel recognized, I have my own worth. I am alone, all alone in my place, nobody meets me, I can still be happy. But even in a crowd, one can feel lonely. Loneliness is a human conundrum. India has more than 1.4 billion. Even in India, people, even though they are with people, they have their parents, wife or children, one person can feel lonely even in a crowd. So feeling lonely is different from being alone. Feeling lonely, makes me feel uneasy about life. Who am I? Why am I here? Why nobody likes me? Why I feel miserable? All that will be connected with loneliness. It is also existential problem. As human beings, ultimately we are alone. But we are supposed to be with people, interact with people, but deep down there may be some loneliness part of our system. Okay. So we need to understand what is being alone, what is feeling lonely. If someone can manage loneliness by developing friendship, by being active in the work, by becoming comfortable with my own hobbies, then I will not feel lonely. If there is no loneliness, those people will have less anxiety about being in a new place or in the hostel. In the olden days, jobs were cut out for one group of people. Let us say they are artistic, they will go into this job. People who are now having different skills will go into this particular kind of job. So there were only a few in the olden days. But now, because of globalization, because of digital growth and so on, the same job will require many skills. Formerly, a carpenter will be a carpenter. If he knows how to make a table or a chair or a cot, or a cupboard, he will thrive. He did not require computer skills in those days. But now, even to make a table, if he doesn't know computer or how to measure in a very, very specific way, he will have a hard time. He may also require mathematics, measurements, so many other things. So these days, finding a good job is not all that easy as in the olden days. But even now, people, especially students, must develop their self-awareness. Who are they? What is their background? What are their skills? What are your special talents? Mere studies, don't give you everything. Academic studies won't give you everything. You must find your inner talents. What are your values? What do you want to do? Let us say you are a very honest person and your mind tells you that you should become a politician. There will be a conflict. Can you be honest as a politician? Very difficult. Okay. You want to work for a company which is cheating. There are many hospitals that cheat, even though you don't require certain tests, they will ask you to go and take these tests and come. Ordinary people suffer. Suppose you are very genuine, honest, can you work even as a doctor in these hospitals? You will go through a lot of stress because you will have to write that you go and take these tests. Why do I need this test? I came for this particular problem. You are asking me to take this test which is unnecessary, but because the hospital demands, you will have to say please go. So will there be value conflicts? In the job that you are going to take up, will you be able to use your talents? Will you be rewarded properly? Will you get a good salary? Will you be able to pay back all the loans that you got for your studies? Okay. Suppose your parents have borrowed a lot of money, will you be able to pay back? So salary is important. Satisfaction is important. You should feel I am in the right field. I am not simply trying out some job and then if I don't like it I will go. There are some people who can jump from one job to another, not all. Some people will get stuck with one job, but will you feel happy throughout your life? Will the salary be enough? Do you feel you are duly rewarded for all your skills and efforts? Do you feel that you will have dignity in this particular job? All these have to be considered. Okay? So, if you go for counseling, for career counseling, this is called career counseling, they will make an assessment of your skills, knowledge, your values and your interests. What are you really interested in? What are you passionate about? If you are not interested, let us say, I am afraid of all animals, let us say. Will I be working as a veterinary doctor? I will be scared, I will develop stress, I will develop illness and then I will die soon. Okay. So, I need to find out my interests, my values, my skills, talents, and then whether this job will give me all that I need for life, for my sustenance and growth. Only then I can decide. But these days students don't know what they are studying, where they would be after their studies. They are waiting for their parents to tell them go in this line, do this job and so on. Or they are waiting for inheritance from the parents. Okay. That is why people are not very clear about what to study. By the time you reach 8th standard, you should know your interests. You can have broad set of interests. Then you can pick and choose. No, I want to become IAS or I want to become a medical doctor. But your marks will not allow you to go. Or your parents may not allow you to go and study a particular thing because it may be very expensive. So if you have broad interests, you can pick and choose, then as a funnel you can go together. Yeah, this is the right set for me. This is the right job, right area. All that you can decide. Our mind generally wants pleasure and wants to avoid pain. This is normal psychology. We want to do things which will give me pleasure, some reward. I want to avoid pain, no suffering. So when people feel the need, I want to relate with somebody, I want to be attached to someone, people look for relationship. This is not because they feel lonely. They may require relationship because it is a need, not because they are lonely. Lonely people also will search. But ordinary people, even though they don't feel lonely, they require relationships. Okay. Sometimes their relationships are not good or not lasting or not helpful or there is a mismatch. Then people go into depression because they don't get good friends or the friends they are available that are available are maybe negative. Okay. So they have to find out whether somebody is a good friend or not. And relationships, did you call it addiction or
infatuations?
Infatuation is part of life. Initially, when you are growing up, you like somebody and that liking becomes very strong and you don't see the negative side of that particular person. It's a kind of a calf love. So we call it infatuation. But it is not wrong. But when they lose reasoning, common sense, if they see something beyond reasoning, which is in the emotional level, or simply because they like, they adore somebody or they do whatever they tell them, then that is wrong. But people come out of infatuation after some time. If you ask other people, let us say I find one lady, wonderful lady, is it true? To me it may be true. For another person that lady may not be wonderful. Then we check with other people, am I right? Am I right in my thinking, in my decision, in my judgment? Shakespeare will say a lover, a poet and a madman are of the same category. They see not with the eye but with the mind. So people can make mistakes even in relationship. There are problems with addiction to alcohol or drugs. It could be cool lips, could be marijuana, could be even stronger drugs like heroin and various other brands there are. People also are used to get addicted to pornography, and this will affect their functioning as human beings, as students. All these will give them some reward. Any addiction is connected with a brain reward they are getting. If the brain doesn't get any reward, any pleasure, it will stop. Because we may not be interested in doing something that is not pleasurable. Like alcohol will increase my pleasure, and so I get addicted. It could be with the porn or anything to do with the brain. So it is basically a brain reward problem. But the consequences are bad. If I get addicted to alcohol, it affects my body, my mind, my liver is affected, my stomach is affected. I will spend a lot of money for buying all these things. It could be money, health, society will consider me bad, or the family is affected because I am spending a lot of money, I am not behaving properly. Okay. So in some way or other, consequences are there. Even those who are addicted will realize their mind is telling them to stop. Don't do this, this is bad, this is not helpful, this is not acceptable. Some judgment will be passed on in their own minds to stop, but they are not able to stop. But they may try a few times. I will stop this, whether it is any sexual behavior or watching pornography or getting addicted to some substance like alcohol, drugs and so on, or simply non-substance addiction. Anything, if it doesn't give me a reward, a brain reward, I will stop it. But it gives reward. But the consequences are bad. My mind is saying both, I need it, I should not do it. That is the problem. So people feel ambiguous about giving up an addiction. Whenever there is ambiguity, we will say no. Sometime afterwards we will say no, I cannot stop it. Whether it is alcohol or pornography, people think they know they are doing something wrong, unnecessary or irrelevant or not helpful, but because they get the reward, brain reward, they continue. So this is the problem. Do they have anxiety? Yes, initially. or periodically. But their anxiety level will come down because they feel the need all the more. I cannot stop it, I need it. I need it to go to sleep. I need it, for being happy. So, even though the addiction in itself is bad, not helpful, it gives some positive psychological gains. Like for example, one person who was addicted to alcohol told me, without taking alcohol, I cannot go to sleep. You said insomnia. Some people have sleep disorders if they don't take alcohol. Why? They are used to taking alcohol before going to sleep. They feel kind of dizzy and they sleep off. But they may wake up after some time or wake up a few times at night. So, they would believe this alcohol is bad in itself, I don't need it, but if I don't take it, I lose many positive psychological gains. Like for example, somebody says, if I take alcohol, I feel courageous. I can go and fight. I can take some achievements easy. So, they believe that they have some positive gains. But in its totality, addiction is bad for body, health and relationships. And I told you self-actualization, people may not move towards self-actualization, they may not use their talents or inner potential. So, addiction is negative. Initially, you think you can control it, but people may not be able to handle if they are really addicted. Use is different from abuse. Abuse is different from dependence. Some people become dependent on pornography. There are students who cannot spend a single day without watching pornography. There are people who cannot spend a day without drinking alcohol or taking drugs. So, they are dependent on it. Once they are dependent, the addiction controls them, they are not able to control the addiction. So, that is bad. They will not be able to help themselves once they become dependent, because they would try a number of times to give up. They realize in experience that they are not able to give up, but they would like to give up. But at the same time, their body and mind will crave for such things, alcohol or drugs or pornography, and then they will once again fail. So, after some time they will say, no, I have no control over my addiction. So, that is feeling miserable about it. They will feel guilty, ashamed, they will not talk about it to other people, they would like to hide the whole habit and then feel secretively guilty. So, a big bundle of negative emotions, actually it does not help them at all. Only counseling and treatment will help. Like for alcohol treatment, if they don't go for treatment, they cannot help themselves if they are already dependent. They are using alcohol once in a way, social drinking, they may be able to stop. Some people are not interested in the after effects of drinking, they can stop. I don't like, so I will stop. But these people will feel there is a craving, body will crave, mind will crave. Even if they have no alcohol, they will be thinking about the previous time they had alcohol. Or next Saturday, suppose they are planning to have alcohol, they will be thinking about it. They will be obsessed about it and they will continue the habit. That is also negative.